starting with Silvia from DG Grow's perspective, and standardization being our area. How can standardization help in relation to dealing with COVID-19?
Well, rather than standardization, I would rather talk about quality infrastructure. So the whole system that goes from standards to conformity assessment to compliance with regulation and all that. And I think that, as you know, the European model is based on trust, is based on the responsibility of the manufacturer, and is based on market surveillance. So if you take these three elements, especially standardization has in Europe a very special framework, which is a public-private partnership between the European Commission and the European standardization body, Sensenel Canetsi. And I must say that during this pandemic, this public-private partnership has worked incredibly well, because sometimes it was even the European standardization body coming forward with some proposal that would help manufacturers or the single market, and in the end also the consumers. And on the other hand, also conformity assessment had to sort of review their way of acting, and trying to simplify where it was possible the conformity assessment of some particularly relevant personal protective equipment or medical devices coming from third countries that maybe had not yet completed the conformity assessment procedure, but that were, let's say, safe enough to circulate anyway and to be put anyway in circulation on the single market. And last but not least, market surveillance obviously had also a very much increased role in checking what was in the European market, and in blocking whatever was not deemed to be safe enough. And you heard on the news everywhere in almost every member state that sometimes masks or respirators coming from third countries were actually blocked because they were not safe enough to be put in circulation.